Thank you, Dr. Quinn, for joining us. Tell us, how can a good family history be helpful for a medical provider?
Man, I cannot overemphasize how valuable it is to myself as a medical provider and all medical providers when our patients come in with a very thorough family history. Because the deal is, a lot of medical conditions are multifactorial, meaning that multiple factors contribute to if that patient is going to develop this disorder and how significant the disorder will be. Some of those factors include a person's lifestyle. For instance, with cardiovascular disease, if they're healthier, eating healthy, exercising, it helps. But if they have that family history, we want to know, because it gives us a lot of information on what tests we need to take for that patient and what treatments, and just it makes things so much better for the patient.
And tell us, what are some of the most common medical conditions in a patient's family history that the doctor would most likely benefit in knowing, so that he or she has the best opportunity to help the patient?
Well, pretty much all medical conditions, as far as a family history, are impacted. But some of the more common that the family history really is used more than less would be, for instance, cardiovascular disease, and also the age. For instance, if a patient had a father that died of a heart attack or stroke at a very young age, say maybe 42 years old, which is very unusual, that's some good information for us medical providers, because we're going to pay really close attention to that patient's blood pressure, their cholesterol. We might even send them for some cardiac testing, but also various forms of cancer as well, because there are certain guidelines, such as certain ages, that we screen for breast cancer, colon cancer, and prostate cancer. But if they have that family history with a very low age of somebody suffering from cancer at a younger age, then we change our screening guidelines for that patient. But the bottom line is, the family history is so helpful. I just cannot overemphasize.
And you actually went on your family reunion this past weekend. Did you make any new discoveries?
I did. Our family reunion was in Atlanta. We had a great time, and we always have that contest. And basically, the talent contest, and I learned I'm the worst dancer. I thought I was the best dancer. I mean, my little crew, my wife, myself, and my brother, we were terrible. But we were terrible dancers. But that's genetic as well. But also, I was able to talk to some of my family members and learn of some family members that had medical problems that I didn't know about, and I plan to report that to my medical provider as well, so that my medical provider can make those informed decisions as far as my care, so that I can have the best chance for the best possible medical outcome.
Mm-hmm. Well, you can always improve on your dance moves, Dr. Quinn.
Yeah, I'm going to take some lessons, because I told him next year, Sam Alexander, I'm coming for you. That's right.
Okay, then.